Commonly accepted practice in the management of... Hello my dear doctor. Now I'll discuss the important topic, that is the Parkinson's disease management. That is 5-star topic for exam. Currently accepted practice in the management of patients with Parkinson's disease is to delay treatment, circle the delay, until the onset of disabling symptoms, so circle disabling symptoms, and then to introduce a dopamine receptor agonist. Once again, dopamine receptor agonist, so circle DRA, dopamine receptor agonist. I said delay, next is the second talk is the disabling symptoms, and start with the dopamine receptor agonist. If the patient is elderly, Levodopa is sometimes used as an initial treatment. So my dear, listen very carefully. Parkinson's disease management is a complicated. Management is tough because you see that we don't know why this Parkinson's disease happened, why this degeneration is happened, why this degeneration of dopaminergic nerves is happening. We don't know. If you know, then we can treat them, we can cure them. We can just control the symptoms starting with bradykinesia, rigidity and tremor, BTR. So the Parkinson's syndrome is nothing but due to the lack of dopamine that we already discussed. That Parkinsonism means bradykinesia. Bradykinesia means reduced movement. Reduced movement means reduced nerves. Reduced nerves means reduced dopaminergic nerves, means reduced dopamine. So reduced dopamine is the reason of causing these syndromes, all the syndromes. So what we can do? We can give directly dopamine, that we call Levodopa, or we can dopamine receptor agonist, means they induce the receptor to release more and more dopamine. Because the patients already have reduced nerves releasing dopamine, so we can induce them to release more and more dopamine. So one of the most important thing, my dear, this is very important, I'd like to give a box here. As I said, the Parkinson's disease management is really difficult. So now the recent guideline says don't start the treatment, and giving the Levodopa is not the treatment. Means the dopamine supplement is not the treatment. What is the treatment? Whenever the patient having the disabling symptoms. So it is said that delay till the time the patient develop the disabling symptoms means interrupting the activity of daily lives. So activity of daily life is interrupted by having this bradykinesia, tremor and rigidity, then the treatment should be started. Because giving the treatment, making some of the important side effects of these drugs is also another problems with this drug in an elderly persons. So what is the indications? Alright, so till the time of development of disabling symptoms you need to wait. So as I said, there's a Parkinson's disease is nothing but the treatment guideline says that is delay. The treatment till the time the patient developing the disabling symptoms. And start with the dopamine receptor agonist. So this is the box that will be helpful to think that the Parkinson's disease treatment. So delay, disabling symptoms and dopamine receptor agonist is now the treatment of choice in Parkinson's disease. Second talk, second SS box. What I am saying, that is very important, just write it down SS box. If the patient is younger, means the patient have some of the neurodegenerative, so some of the nerves still present, they can release the dopamine. So younger group of patients that we can induce the receptor to release more and more dopamine. So yes, the younger group of patients should be started with the dopamine receptor agonist. I hope that you got it. So just write it down. Young person, young means alright, less than 75, alright, in developed world. So young people should be started with the dopamine receptor agonist, and the older persons means greater or equal 75 years, you can start with the levodopa, means the dopa, means levodopa. That is the box. Because giving the dopamine supplements directly, yes, that is best. That is the best to control the symptoms of the Parkinsonism. But what is the problem with that? We are coming, and just follow me what is written in the notes. Dopamine receptor agonists are the bromocriptine, ropinirole, cabergoline, apomorphine. Yes, dopamine receptor agonists, just write it down, DRAS, in a small box, that will be helpful. And the drugs are, you see the bromocriptine, ropinirole, cabergoline, and apomorphine. Ergot-derived dopamine receptor agonists are bromocriptine, cabergoline, and pergolide, have been associated with the pulmonary, retroperitoneal, and cardiac fibrosis, circle the fibrosis. The Committee on the Safety Medicines advised that an echocardiogram, ESR, and creatinine and chest X-ray should be obtained prior to the treatment, and patients should be closely monitored. Patients should be warned about the potential for dopamine receptor agonists to cause the impulse control disorder and excessive daytime somnolence. So circle disorder, circle daytime, that will be helpful. More likely than levodopa to cause hallucinations in older persons, and nasal congestion and postural hypotension are also seen in some patients. I'd like to give a box here. So dopamine receptor agonist, the SS box of dopamine receptor agonist, what I'm saying, you just write this A, B, C, D. So dopamine receptor agonist, or you can write, or dopamine receptor agonist are D is the best drug. Then you can write C, B, A, just reverse, alright. So that is the box. Why I am writing this D, B, C, B, A means A, B, C, D, alright. So yes, D stands on, C stands on, B stands on, and A stands on. Just write it down. A for apomorphine, B stands on the bromocriptine, just write it down, bromocriptine, and C stands on the cabergoline, and D, I just changed the name of ropinirole is the dopinirole, that will be helpful. Ropinirole, alright. I'm just changing the dopinirole, no problem. Ropinirole. So dopinirole, ropinirole, not will be problem. Alright. This is ropinirole. That I just changed, that will be helpful. That's a dopinirole that must be remembered, my dear. So D, as I say, that's why I just DCBA I've just written. And ergot-derived dopamine receptor agonists are bromocriptine and cabergoline. So C and B, just make a red mark. Cabergoline and bromocriptine, and also the pergolide are nothing but the ergot-derived dopamine receptor agonist. So we can write in a side box, ergot-derived dopamine receptor agonist. EDDRA. That will be helpful. Just write it down the way I'm writing. And another small box that will be helpful, SS box of dopamine receptor agonists, as I said, that you need to remember a single drug, that is dopinyrole. So we need to dopinyrole, D for disease or disorder, that will be helpful, and D for daytime somnolence. These two D's, that dopinyrole, that we must remember, that will be helpful. Dopamine receptor agonist, I said that the D for disorders means the impulse control disorders. Just write it down, impulse, ICD is impulse control disorders. It is written, right? And also the daytime somnolence. Just write it down. These are side effects. So these two boxes of the dopamine receptor agonist will be helpful. I'll discuss a little bit more after writing all the boxes. Next, you come up with the levodopa, usually combined with the decarboxylase inhibitor. Dopa with decarboxylase inhibitor, DD inhibitors, that is carbidopa or benserazide. With carbidopa-levodopa combination, we call the cinemat, and levodopa-benserazide is the meropart that we discussed in the previous video clips of Parkinson's disease features. To prevent the peripheral metabolism of levodopa to dopamine, so that we can get the more and more dopamine. So yes, the levodopa plus carbidopa or benserazide. Reduced effectiveness with time, usually by 2 years, circle 2 years. And unwanted effects, that is the dyskinesia, make a start, involuntary reading movements, and on and off, dry mouth, anorexia, palpitations, postural hypotension, psychosis, drowsiness, and no use in neuroleptic or drug-induced Parkinsonism. So I'd like to write here about the levodopa. Yes, the SS box about the levodopa. So I am saying this levodopa is nothing but the dopamine. Levodopa is nothing but the dopamine. So these levodopa are combined with the decarboxylase enzyme inhibitors, and these decarboxylase enzyme inhibitors are carbidopa or benserazide. That will be helpful. So what you need to know, we need these two another D's, that is dyskinesia. This is the one important point that we need to remember. And the dry mouth. Yes. And third talk that we need to remember, that is drop blood pressure. Means yes, postural drop, that is postural hypotension, we can say. And some drowsiness and some psychosis we need to remember, along with some other effects that we'll discuss in future in part 2, read more and more along with these drugs. But you need to remember these important talks here. Next is the Mao B inhibitors, that is a monoamine oxidase B inhibitors. Just follow me what is written in your notes, like the seleglin inhibits the breakdown of the dopamine secreted by the dopaminergic neurons. Then you see it is written in your notes, that is amantadine. Mechanism is not fully understood, probably increases dopamine release and inhibits its uptake at dopaminergic synapses. Side effects are ataxia, slurred speech, confusion, dizziness, and libido reticularis. And also another drug, you see the COMT, that is COMT, catechol O-methyltransferase inhibitors. There is entacapone, tolcapone, and COMT is an enzyme involved in the breakdown of dopamine and hence may be used as an adjunct to levodopa therapy. So used in conjunction with the levodopa in patients that have established Parkinson's disease. And some drugs like the antimuscarinics block cholinergic receptors and now used more to treat drug-induced Parkinsonism rather than the idiopathic Parkinson's disease. And these help basically the tremor and rigidity. Procyclidine, benztropine and trihexyphenidyl like benzaxol. My dear, before going to the other drugs, I'd like to give in box, that is SS box of anti-Parkinson's drugs. Means the PD drugs treatment, what treatments available. What I'm saying, the PD treatment is nothing but, we can say, that is A, B, C, D. That is important. I am writing A, B, C, D once again from right to left, so that will be helpful because D stands on, once again, I say it. D stands on the dopamine receptor agonist. D stands on dopa, means the levodopa, carbidopa. We can remember. Next is the C. C stands on COMT inhibitors. Alright? COMT inhibitors once again are the rule of C. We can remember. You see the entacapone and tolcapone. So you are writing capones. Just write it down, capones, right? Entacapone, entacapones and tolcapones. That would be helpful. Next is the B. B is nothing but Mao B Inhibitors. So we can write the B inhibitors. That is sileglin. I am telling not the sileglin is rather than bileglin. Alright. So B inhibitors, bileglin. That will be helpful. Just write it down the way I am writing. And last, A for amantadine and A for anti-muscarinics. That is helpful. Anti-muscarinics or anticholinergic drugs. So make a box these drugs, that will be helpful. So PD drug, once again, dopamine is absent or dopamine is reduced. So let's start with the D. D for dopamine receptor agonist. Once again, dopamine receptor agonist box are here. Once again, D, C, B, A. D for dopininol, dopinirol. C for cabergoline, pergolide. And B for bromocriptine, A for apomorphine. And once again, D for dopa, levodopa, carbidopa combinations, right? And C for COMT inhibitors, the capones. And B for Mao B inhibitors, bileglin or sileglin, right? So B. And A for amantadine and antimuscarinic drugs, means anticholinergic drugs. I'd like to discuss a little bit more. So within the bracket of dopamine receptor agonist, we can write D, C, B, A. And within the bracket of dopa, that is levodopa plus carbidopa or benzorazide. And COMT is entacapone, tolcapone, Mao B inhibitor, bileglin and amantadine and antimuscarinic drugs. You just write down the antimuscarinic drugs are procyclidine, benztropine and benzaxol. So antimuscarinic drugs are, just write it down, benzaxol, that you need to remember, benzaxol. Another name of the benzaxol that you see in your notes, it is written trihexyphenidyl. Forget it. Benzaxol is the best drug. What I'm saying? Benzaxol, B for best drug. Remember, for the antimuscarinic is to control the tremor. Next box I would like to give that will be helpful regarding a small box of amantadine. A small box of amantadine. So yes, my dear, amantadine is once again, a single talk, amantadine, A for ataxia, we can remember. Just say with me, A for ataxia. Mantadine, man means mon, alright, means mind, alright, mon, mind. Man means mind, alright, confusion. This is common with this drug. You see the side effects, it is written in your notes: ataxia, slurred speech, confusion, dizziness, and libido reticularis that I am talking about. Man, tadine, T for talk. So talk problems means the slurred speech. You can write the talk problem. Amantadine. Then din, once again, just remember with that, din is nothing but dizziness. So this is the another box, SS box of amantadine itself is A for ataxia, man means man, mon, mind, confusion, and ta means talk. Din for dizziness, alright, that's really helpful. So these are the very important boxes, my dear, that we already discussed here. So I'd like to discuss a little bit more, so that will be helpful once again. As I said, my dear, this is very important. The Parkinson's disease management is very difficult and very complicated management here. And which drug and different varieties of the drugs are available. So choosing the best drug for the best interest for the patient, for the best help for the patient, that is a bit of complicated. But the basic things, the most important things that we are discussing in these boxes. When you grow up, like in Part-1, and we'll discuss more complicated things from here, the drugs, and which drug will be best for the patients. Alright. So my dear, listen very carefully, starting with the first box. Here the Parkinson's disease treatment, the new strategy of the treatment, yes, the delay, because of, we know the Parkinson's disease is reduce the dopamine because of bradykinesia, means reduced kinesia, reduced dopamine. So dopa, D for delay, D for disabling symptoms, D for dopamine receptor agonist. So till the time of disabling symptoms the patient may have, you should delay the treatment, and you should start with the treatment with the DRS. The second box is said the young people's DRS should be treated first, and older group of people's then the dopamine supplement should be used. And you see that the effectiveness with the Levodopa, yes, is effectiveness of the Levodopa is reduced after 2 years. So right in this box it will be helpful. So I'm coming here. So if you start young people with the dopamine or Levodopa, carbidopa combinations, so you see that after 2 years no effectiveness. So what is the benefit of giving this supplement? So supplement is we are reserving the supplements later. We are trying to put ourselves or put the patients on the dopamine receptor agonist to induce dopamine release more and more in a younger group. So young patients, dopamine receptor agonist, older group of patients, dopamine supplement. Now talk about what treatments are available. That should be the third boxes. There is the SS box of PD treatment and the drugs available here. So because we are talking with the dopamine, so start with the D, means the DCBA, means ABCD is the treatment. So D stands for the dopamine receptor agonist, dopamine supplement, C for COMT inhibitors, B for B inhibitors, and A for amantadine and antimuscarinics or anticholinergic drugs that are available here. What I said? Once again, Parkinson's disease treatment is the dopamine less or dopamine absent. So give starting with the D. D for DRS means the dopamine receptor agonist. D for dopa means the levodopa carbidopa. And then C for COMT inhibitors. And B for B inhibitors means, yes, the Mao B inhibitors, seleglin, beleglin, B inhibitors, beleglin. And A once again amantadine. A once again antimuscarinics. Yes, my dear. So these are the drugs, once again, in an anti-muscarinic drugs, I would like to say the benzaxole, benztropine, and also the procyclin. These 3 drugs are available, but you must remember about the benzaxole or trihexyphenidyl benzaxole base drug. Benzaxole is the base drug to control the tremor. And the 4th box, once again, you see, the dopamine receptor agonist. This is important. What are the dopamine receptor agonists? DRAs are once again D, C, B, A, or A, B, C, D. So start with the dopamine receptor. The base drug is the D once again, dopineural. You see the dopineural. We put the D instead of R. So yes, the dopineural is the ropineural. So dopineural is the base drug among all the drugs that are available here. So C for once again cabergoline and pargolide, and B for bromocriptine, and F for apomorphine. So I make the red marks of these ergot derivatives. Dopamine receptor against the cabergoline and bromocriptine, the BC. These are the drugs. These are responsible for fibrosis. These words must be remembered. STAN. Fibrosis. And these fibrosis, retroperitoneal, cardiac, respiratory. So the long list of organ fibrosis these drugs are causing. So ergot derivatives, dopamine receptor agonists are C for cabergoline and P for bromocriptine, and last is the apomorphine, A for apomorphine. So yes, once again, dopamine receptor agonists are A, B, C, D, or D, C, B, A, D for doperinol, C for cabergoline, pargolide, and D for bromocriptine, A for apomorphine. So these are the drugs available for dopamine receptor agonist. 5th box, once again, the dopamine receptor agonists are dopineural. Alright, so the 2 side effects that we need to remember, once again, disorder and daytime somnolence. Means impulse control disorders and daytime somnolence must remember, my dear. So dopamine receptor agonist, D for disorders, D for daytime somnolence. 6th box about the levodopa and carbidopa. Dopa once again and the peripheral dopamine decarboxylase inhibitors. So once again you see the must to remember that is dyskinesia, the single D for dopa, D for dyskinesia. So as I said, the Parkinson disease is a bradykinesia, reduced kinesia, means the reduced dopamine. So we are giving the dopamine supplement to increase the movement kinesia. So it can change sometimes the hyperkinesia. You have the movements of this one, pill rolling. Now it changed like that, choreoathetoid movement. So what is better? This is better or this is better? Alright, so this kinesia is very problematic with this levodopa and carbidopa. So yes, once again, D for dopa and D for dyskinesia that we must remember. Another 3 Ds, dry mouth, drop postural, drop of blood pressure, and D for drowsiness and psychosis, and also other side effects we will study in future in part 2 written. Next is the 7th box, the last box is the amantadine. The drug is amantadine. It's very important you see the amantadine, A for ataxia, man means mon means mind, means confusion, ta means talk, and din for dizziness. That will be helpful. I hope that these boxes, the 7 boxes, the most important parts that we already discussed about the treatment, and that will be helpful, my dear, in part 1. Yes, so once again I'd like to give a summary box and most important thing from each and every boxes. So the box 1, Parkinson disease, is dopamine is less. Yes, so delay disabling dopamine receptor agonist. Delay the treatment till the time patient has disabling symptoms. Second box, young group dopamine receptor agonist, older groups levodopa, dopa supplement. Third box, there is a Parkinson disease treatment, dopamine less. So he has once again dopamine supplement or dopamine receptor agonist. So D is the treatment. So we put D, C, B, A, or A, B, C, D is the treatment of choice. So A, B, C, D you can remember. And A for anti-muscarinic is A for amantadine once again. So A for anti-muscarinic drugs are benjexol, benztropine, and also the prosectidine. But the benjhexol or trihexyphenidyl is the best drug. Benjexol is the best drug. We need to remember, benjexol is the best drug. Fourth box is once again dopamine receptor agonist are D, once again, dopamine is the best drug. And A, B, C, D, once again, A for apomorphine, B for bromocriptine, C for cabergoline, D for dopamine. And once again, the ergot derivatives, dopamine receptor agonist are cabergoline, pergolide, and B for bromocriptine, so B, C are associated with the fibrosis. And fifth box, dopamine receptor agonist, dopamine receptor agonist, the dopinirole, disorder and daytime somnolence. Disorder, daytime somnolence. Sixth box, levodopa, dopa, once again, must remember dyskinesia or hyperkinesia or choreotheatoid movements. In other words, dry mouth, drop, and drowsiness. And last, amantadine, A for ataxia, single word that you must remember, A for ataxia, M for amantadine. Man means mon, means mind, means the confusion. Ta means talk, means the short speech. And din for, of course, you can remember, that is the dizziness. So these are the side effects and important talks of the anti-Parkinson disease management and their pitfalls and the side effects all together that we discussed here. That will be helpful, my dear. Thank you. Thank you very much.